Hi, I'm Steve Knighton from Nottinghill Family Wellness Centre, and today we're going to talk about rib subluxations, for lack of a better word. We don't really throw that word around the clinic here, but this is basically a pain in most of the time your middle back, most likely picks a side, coughing, deep breath, really hurts, could be a sharp stabbing pain. We've actually had patients go to the hospital before because they thought they were having heart attacks. I'm going to actually try to draw this one while we're doing it. So here on our little model Steph here is her spine as it comes down here. Now there are 12 ribs down the back. Off the side of your spine here on your vertebrae, there's little things called the TVP. So little arms off of the thoracic spine which allow the ribs to attach and a bunch of muscle attachments. Now the ribs, for all intents and purposes, come down like this. A little bit of an angle, I'll make it up and say 40 degrees. I have no clue what it is. What happens when a rib goes out of whack? It's attaching up here in this joint. It basically gets either out, up, down, could move a little forward, and there's a lot of pain directly on here. We've actually had a patient come in who probably wasted about $10,000 worth of OHIP spending on, I believe it was 1 MRI, 2 CT scans, and a bunch of x-rays and blood work at Oakville here. And actually they sent it to a specialist in Hamilton. A younger kid unfortunately had an accident where, like I said, a younger kid, when he was trying to run over a moving car and fell over backwards. So they thought the rib was broken, which would make sense. X-rays clear, okay, it could be broken and you maybe take a little bit to heal and didn't pick up an x-ray. But overall, 2, 3, 4 months later, he was still sharp pain. He was actually doing at the time working for a landscaping company for a summer job, and you have to wear a backpack with the blower on it, which is excruciating pain. 15 minutes of the backpack and he was toast for a day or two. So what actually happened was he was diagnosed with the rib subluxation. So this was out, and for him it was actually a little bit of swelling and stuff in the intercostal muscle here. We got that rib back into place. I'm going to say it took 3 visits, less than 150 bucks, and he was basically 90% good. So essentially, if you do have pain in the back, come in, but it's off the side, you know it's a rib. Ice it right away. As long as it's something more severe, you don't have to go to the hospital. Once again, this is Dr. Steve Knighton for Notting Hill Family Wellness Centre.